ಅಂತ ಇಕ್ವಿಪ್ಮೆಂಟ್ಸನ್ನು ನಾವು ಬೇರೆಯವರಿಗೆ ಬಳಸಿದರೆ ಅದರಿಂದವೂ ಸಹ ಈ ರೋಗ ಹರಡುತ್ತದೆ. ಅದರ ಜೊತೆಗೆ ನೀವು ಅದನ್ನು ಕೇಳಿದ್ದೀರಾ, ತಾಯಿಯಿಂದ ಮಗುಗೆ ಗರ್ಭಾಶಯಲ್ಲಿರುವಾಗ ಆವಾಗಲೂ ಬರುವ ಸಾಧ್ಯತೆಗಳು ಇರ್ತವೆ. ಅದಲ್ಲದೆ ಬ್ರೀಸ್ಟ್ ಫೀಡಿಂಗಿಂದ ಒಂದು ತಾಯಿಗಿದ್ದರೆ ಆ ಬ್ರೀಸ್ಟ್ ಫೀಡಿಂಗಿಂದನೂ ಸಹ ಅದು ಮಗುಗೆ ಬರುವ ಸಾಧ್ಯತೆಗಳು ಇರ್ತದೆ. ಅದಕ್ಕಾಗಿ ನಾವು ಇದನ್ನು ಹರಡಬಾರ್ದಂತ ನಾವು ಮುಂಜಾಗ್ರತಾ ಕ್ರಮಗಳನ್ನು ಕೈಗೊಳ್ಳಬೇಕಾಗಿದೆ. ನಾವೊಂದು ಒಳ್ಳೆಯ ಉದ್ದೇಶಕ್ಕಾಗಿ ಇಲ್ಲಿ ಸೇರಿದ್ದೇವೆ, ಒಂದು ಸೋಷಿಯಲ್ ಕಾಸಿಗೆ. ನಮ್ಮ ಉದ್ದೇಶ ಏನಿರಬೇಕು ಅಂತಂತಂದರೆ ನಮ್ಮವರು ಈ ರೋಗದಿಂದ ಫ್ರೀ ಆಗಿರಬೇಕು. ಅದಕ್ಕಾಗಿ ಹೆಚ್ಚಿನ ಜವಾಬ್ದಾರಿ ಇರೋದು ನಿಮ್ಮ ಮೇಲೆ. ಪ್ಯಾರಾಮೆಡಿಕಲ್ ಸ್ಟೂಡೆಂಟ್ಸು, ನರ್ಸಿಂಗ್ ಸ್ಟೂಡೆಂಟ್ಸು, ನಿಮ್ಮ ಮೇಲೆ ಒಂದು ತುಂಬ ದೊಡ್ಡದಾದ ಜವಾಬ್ದಾರಿ ಇದೆ. ನೀವು ಇದರ ಬಗ್ಗೆ ಅರಿವು ಮೂಡಿಸಬೇಕಾಗಿದೆ. ಜನರಲ್ಲಿ ಅರಿವು ಮೂಡಿಸಿದ್ರೆ ಮಾತ್ರ ನಾವು ಈ ರೋಗದಿಂದ ದೂರ ಇರಬಹುದು, ಇದನ್ನು ಸಂಪೂರ್ಣವಾಗಿ ನಿರ್ಮೂಲನೆ ಮಾಡಬಹುದು. ಇದು ಒಂದೇ ಇದಕ್ಕೆ ಮದ್ದು. ಅದಕ್ಕಾಗಿ ಈ ವರ್ಷ ನಾವು ಒಂದು ಹೊಸ ಥೀಮ್ನೊಂದಿಗೆ ಈ ದಿನವನ್ನು ಆಚರಿಸ್ತಾ ಇದ್ದೀವಿ. ನಿಮ್ಗೆಲ್ಲರಿಗೂ ಗೊತ್ತಿದೆ, ಆ ಬ್ಯಾನರ್ ಮೇಲೂ ಸಹ ಬರೆದಿದ್ದಾರೆ, ಲೆಟ್ ಕಮ್ಯುನಿಟೀಸ್ ಲೀಡ್. ನಾವು ಒಟ್ಟಿಗೆ ಇದಕ್ಕೆ ಪ್ರಯತ್ನ ಮಾಡಬೇಕಾಗಿದೆ. ನಮ್ಮ ಧ್ಯೇಯ ಏನೇ ಇರಬೇಕು, ಫಸ್ಟು ನಮ್ಮ KGF ಈ ರೋಗದಿಂದ ಫ್ರೀ ಆಗಿರಬೇಕು ಅಂತ ನಾವು ನಮ್ಮ ಧ್ಯೇಯನ ಇಟ್ಕೋಬೇಕು. ನಂತರ ನಮ್ಮ ರಾಜ್ಯ, ನಮ್ಮ ದೇಶ ಯಾರಿಗೂ ಈ ಕಾಯಿಲೆ ಬರಬಾರ್ದು ಅಂತ ಹೇಳಿ ನಾವು ನೋಡ್ಕೋಬೇಕಾಗಿದೆ. ಈ ಸಂದರ್ಭದಲ್ಲಿ ಇನ್ನೊಂದು ವಿಚಾರ ನಿಮ್ಗೆ ಹೇಳಬೇಕಂತಂದರೆ, ಇದೊಂದು ಕಾಯಿಲೆಯನ್ನು ಕೇಳಿದರೆ, ನಾವು ಒಬ್ರಿಗೆ ಇದೆ ಅಂತ ಕೇಳಿದರೆ ನಾವು ಅವನ ಬಗ್ಗೆ ಬೇರೆ ರೀತಿಯಾಗಿ ಯೋಚನೆ ಮಾಡ್ತೇವೆ. ಅದೇ ನಡೀತಾ ಇರೋದು ಇವಾಗ. ಇದೊಂದು ಸ್ಟಿಗ್ಮಾ ಅಂತ ನಾವು ತಿಳ್ಕೊಂಡಿದ್ದೀವಿ. ನಾವು ಅವ್ರನ್ನ ಕಡೆಗಣಿಸ್ತೀವಿ, ತಾರತಮ್ಯ ಮಾಡ್ತೀವಿ. ಎಷ್ಟೋ ಕಾರ್ಯಗಳಲ್ಲಿ ಅವ್ರನ್ನ ಕರೆಯೋದಿಲ್ಲ. ಉದಾಹರಣೆಗಳು ತುಂಬ ಇದ್ದಾವೆ. ಎಷ್ಟೋ ಎಂಪ್ಲಾಯ್ಮೆಂಟ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಸಲ್ಲಿ, ಎಜುಕೇಷನ್ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಸಲ್ಲಿ ಅಂಥವ್ರನ್ನ ಎಷ್ಟೋ ಜನ ಸೇರಿಸ್ಕೊಳ್ಳಲ್ಲ. ಕಾಯಿಲೆ ಇದ್ದವ್ರನ್ನ ದೂರ ಇಡ್ತಾರೆ. ಅದಕ್ಕಾಗಿ ನಿಮ್ಗೆ ಇದರ ಬಗ್ಗೆನೂ ಗೊತ್ತಿರ್ಬೋದು. ಒಂದು ಕಾಯ್ದೆ ಬಂದಿದೆ, ಲಾ ಬಂದಿದೆ. ಏನು ಅಂತಂತಂದರೆ HIV and AIDS ಪ್ರಿವೆನ್ಷನ್ ಆ್ಯಂಡ್ ಕಂಟ್ರೋಲ್ ಆ್ಯಕ್ಟ್ 2017. ಅದು ಹೇಳುತ್ತೆ, ನಾವು ಯಾರ ಜೊತೆ ತಾರತಮ್ಯ ಮಾಡಿದರೆ, ಏಡ್ಸ್ ಇದೆ ಅಂತ ಒಂದೇ ಕಾರಣಕ್ಕೆ ಅವನ ಜೊತೆ ಸರಿಯಾಗಿ ನಡೆಸದೇ ಇದ್ದರೆ ಇದೊಂದು ಅಪರಾಧ. ನೋಡಿ, ನಾವು ಅವ್ರಿಗೆ ಬೇಕಾಗಿರೋದು ಏಡ್ಸ್ ರೋಗಿಗೆ ಒಂದು ಮಾನಸಿಕ ಬೆಂಬಲ, ಒಂದು ಮೆಂಟಲ್ ಸಪೋರ್ಟ್ ಬೇಕಾಗಿರುತ್ತೆ ಅವ್ರಿಗೆ. ಯಾಕಂದರೆ ಅವ್ರು ಇರುವವರೆಗೆ ನೆಮ್ಮದಿಯಿಂದ ಜೀವಿಸಬೇಕು, ಎಲ್ಲ ಜೀವನದ ಎಲ್ಲ ಖುಷಿಯನ್ನು ಸಂತೋಷವನ್ನು ಪಡ್ಕೋಬೇಕಂತಂದರೆ ಬೆಂಬಲ ನೀಡಬೇಕಾಗಿದೆ. ಅದಕ್ಕಾಗಿ ನಾವು ಜನರಲ್ಲಿ ಏನು ಅವರು ಮೂಡಿಸಬೇಕಾಗಿದೆ ಅಂತಂತಂದರೆ, ನಾವು ಕೇವಲ ಅವ್ರ ಜೊತೆಗೆ ವಾಸಿಸಿದರೆ, ನೆಲೆಸಿದರೆ ರೋಗಿಯ ಜೊತೆ ಈ ರೋಗ ಹರಡಲ್ಲ. ಎಲ್ಲರೂ ಅವ್ರು ಕುಡಿದಂಥ ನೀರನ್ನು ನಾವು ಕುಡಿದರೂ ಸಹ ಇದು ಬರಲ್ಲ. ನೆಗಡಿ, ಜ್ವರ, ಕೆಮ್ಮಿನಿಂದ ಇದು ಬರಲ್ಲ. ಗಾಳಿಯಿಂದ ಇದು ಹರಡಲ್ಲ. ಅವರು ಊಟ ಮಾಡುವ ತಟ್ಟೆಯಲ್ಲಿ ನಾವು ಊಟ ಮಾಡಿದರೂ ಸಹ ಅದು ಹರಡಲ್ಲ. ನಾವು ಶೇಕ್ ಹ್ಯಾಂಡ್ ಮಾಡಿದ್ರು, ಹಗ್ ಮಾಡಿದರೂ ಸಹ ಇದು ಹರಡಲ್ಲ. ಇದನ್ನೆಲ್ಲ ನಾವು ಜನರಿಗೆ, ಸಾರ್ವಜನಿಕರಲ್ಲಿ ತಿಳಿಸಬೇಕಾಗಿದೆ. ಇದು ಬರೋದು ಮೂರೇ ಕಾರಣದಿಂದ. ಒಂದು ಅನ್ಪ್ರೊಟೆಕ್ಟೆಡ್ ಸೆಕ್ಸು, ಜೊತೆಗೆ ಇಕ್ವಿಪ್ಮೆಂಟ್ಸನ್ನು ಬಳಸಿದರೆ ಬೇಗೆ, ಮತ್ತು ಇನ್ನೊಂದು ತಾಯಿಯಿಂದ ಮಗುಗೆ. ಇದೊಂದು ಮೂರನ್ನು ಬಿಟ್ಟರೆ ನಾವು ಇದರಿಂದ ನಾವು ಸೇಫ್ ಆಗಿರ್ಬೋದು, ಸುರಕ್ಷಿತವಾಗಿರ್ಬೋದು. ಅದಕ್ಕಾಗಿ ಇದರ ಬಗ್ಗೆ ತುಂಬ ಜನರಿಗೆ ಅರಿವಿನ ಕೊರತೆ ಇದೆ. ಅದರಿಂದಾಗಿ ಅವರು ಅಂಥವ್ರ ರೋಗಿಗಳ ಜೊತೆ ದುರ್ವ್ಯವಹಾರ ಆಗಿ ನಡೆಸ್ಕೋತಾರೆ. ಇದನ್ನೆಲ್ಲ ನಾವು ಅವರಲ್ಲಿ ಮನವರಿಕೆ ಮಾಡಬೇಕಾಗಿದೆ, ಅವರಲ್ಲಿ ಅರಿವು ಮೂಡಿಸಬೇಕಾಗಿದೆ. ಇದಕ್ಕೆ ನಿಮ್ಮ ಸಹಕಾರ ತುಂಬ ಮುಖ್ಯ. ನಿಮ್ಮ ರೋಲು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟು. ಪ್ರತಿಯೊಬ್ಬ ಮನುಷ್ಯನಿಗೂ ಈ ಪ್ರಕೃತಿಯಲ್ಲಿ, ವಿಶ್ವದಲ್ಲಿ ಜೀವಿಸುವ ಹಕ್ಕು ಇದೆ. ಅದಕ್ಕಾಗಿ ಮಾನವ ಹಕ್ಕುಗಳು ಇರುವುದಿಲ್ಲ. ಒಬ್ಬ ವ್ಯಕ್ತಿ ರೋಗಿಯಾಗಿ ಏನಂತಂತಂದರೆ ಅವನ ಹಕ್ಕು ನಾವು ಕೊಡದೇ ಇರೋಕ್ಕಾಗಲ್ಲ. ಅವನಿಗೂ ಸಹ ಹಕ್ಕುಗಳಿವೆ. ಪ್ರತಿಯೊಬ್ಬ ಜೀವಿಗೂ ಸಹ ವಾಸಿಸುವ ಹಕ್ಕಿದೆ. ಅದಕ್ಕಾಗಿ ಆ ಹಕ್ಕುಗಳನ್ನ ನಾವು ಎಲ್ರಿಗೂ ಪ್ರೊವೈಡ್ ಮಾಡಬೇಕಾಗಿದೆ. ಈ ಒಂದು ಕಾಯಿದೆಯಿಂದ ಯಾರ ಮಧ್ಯೆ ನಾವು ತಾರತಮ್ಯ ಆಗಬಾರ್ದು, ಯಾರಿಗೂ ನೋವುಂಟು ಆಗಬಾರ್ದಂಗೆ ನಾವು ನೋಡ್ಕೋಬೇಕಾಗಿದೆ. ಅದಕ್ಕಾಗಿ ನಾನು ಹೇಳಿದೆ ಅಲ್ಲ, ಇದಕ್ಕೆ ಒಂದೇ ಮದ್ದು ಇದು ಕೈಲಿಂದ ನಾವು ಸೇಫ್ ಆಗಿರಬೇಕು ಅಂತಂತಂದರೆ ಇದಕ್ಕೆ ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡಬೇಕು. ಈ ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡಿದಾಗ ಮಾತ್ರ ನಾವು ಈ ಕಾಯಿಲೆಯಿಂದ ನಾವು ದೂರವಾಗಿರ್ಬೋದು. ಜೊತೆಗೆ ರೋಗಿಗಳ ಜೊತೆ, ಏಡ್ಸ್ ರೋಗಿಗಳ ಜೊತೆ ನಾವು ಚೆನ್ನಾಗಿ ಬಾಂಧವ್ಯದಿಂದ ಇರ್ಬೋದು. ಹಾಗಾಗಿ ಇದೊಂದು ಸೇರೋದಕ್ಕೆ ನಾವು ಈ ಒಂದು ಸಂಕಲ್ಪವನ್ನು ಮಾಡ್ಕೊಳ್ಳೋಣ. ನಮ್ಮ ಕೈಜೆಪ್ಪಲ್ಲಿ ಯಾವುದೋ ವ್ಯಕ್ತಿಗೆ ಏಡ್ಸ್ ರೋಗ ಬರಬಾರ್ದಂಗೆ ನಾವು ನೋಡ್ಕೊಳ್ಳೋಣ. ಅದಕ್ಕೆ ಏನೆಲ್ಲ ಮುಂಜಾಗ್ರತಾ ಕ್ರಮಗಳು ಬೇಕು ಅದನ್ನೆಲ್ಲ ನಾವು ಮಾಡ್ಕೊಳ್ಳೋಣ. ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡೋಣ ಜನರಲ್ಲಿ. ಇದೊಂದು ಈ ದಿನದ ಆಚರಣೆ ಅಷ್ಟೇ ಇರಬಾರ್ದು, ನಾವು ಪೂರ್ತಿ ವರ್ಷವೆಲ್ಲ ಇದನ್ನು ಆಚರಣೆ ಮಾಡಬೇಕು. ಆಚರಣೆ ಮಾಡಬೇಕಂತಂದರೆ ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡಬೇಕು. ಇಂಥ ಎಲ್ಲ ಕಾರ್ಯಕ್ರಮ ಮಾಡುವ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ಹಾಗಾಗಿ ತಾವೆಲ್ಲ ಇದರಲ್ಲಿ ಕೈ ಜೋಡಿಸಿದರೆ ನಾವೊಂದು ಹೆಲ್ದಿ ಸಮಾಜವನ್ನು ನಿರ್ಮಾಣ ಮಾಡ್ಬೋದು ಅಂತ ನಾನು ಭಾವಿಸ್ತೇನೆ. ಅದಕ್ಕಾಗಿ ನಾವೆಲ್ಲರೂ ಕೈ ಜೋಡಿಸೋಣ, ಈ ಕಾರ್ಯಕ್ರಮವನ್ನು ಯಶಸ್ವಿಗೊಳಿಸೋಣ ನಾವೆಲ್ಲರೂ ಅಂತ ಹೇಳಿ ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ನನ್ನನ್ನು ಕರೆಸಿ ಮಾತನಾಡಲಿಕ್ಕೆ ಅವಕಾಶ ಮಾಡಿಕೊಟ್ಟಿದ್ದಕ್ಕಾಗಿ.
Children, I would like to ask you one thing. If an HIV patient comes, if an AIDS patient comes here, how many of you will come and have a handshake with it? Please raise your hand. I really thank all of my children who have raised your hand. But at the same time, many of you have not raised your hand. We will make you raise your hand at the end of this program. Today, here, Indian Medical Association KGF, in association with KGF TALUK Legal Services Committee, TALUK Health Department, and KGF Advocates Association, we are joined here to make the point that you can have a handshake, you can hug them, you can kiss them, you can share your coffee or tea, you can share their food. It really will happen. So we have taken this responsibility today on this 35th World AIDS Day. We are gathered here. The theme of this year is let the community lead. The community in the sense we are also community, but here the community means the community of the people who are suffering from HIV and AIDS. This community also must come forward and lead the community, saying that I am also like one of you. I am also one of the community like any normal person. So this is really happening, but the only thing is many of us do not know that how it is. And that is the reason why many of our children could not raise their hands because of stigma. So we have to break the stigma. Really we have to break the stigma and come out and support the HIV patients. They are not something different. Knowingly, unknowingly have got it. Many of them knowingly have got it, and many of them they do not know they have got it because of some reasons. So today the theme is let the community lead. So at present there are about 4 crores. There are about 4 crore people living with HIV at the end of 2022. At the end of 2022 we have 4 crore people living with HIV, and 6.3 lakhs people died from HIV and AIDS. Almost half. Every year this happens. If 1 lakh people get infected, 50,000 people dies. They are also not aware what is available in the government with the hospital or health department. They also not know or ignore about that one, and they also stuck with the stigma, and they don't come out, and they don't want to others know that they got HIV. We want to change the situations. We want to make them, and we have to break the stigma, and they have to break that barrier barrier and come out and say that bold. They can say at the end of this one, everybody will understand why and how. They can say that I am also like one among you. Though I have AIDS, nothing will happen. So we'll see that one. So the target for 2025, it is 95 and 95 and 95. Means 95% of the HIV people, 90%. And 95% of the people must get the treatment for HIV. And 95% of the people should achieve nil or viral load. So what is this nil viral load? Please see after what is this nil viral load? HIV means actually HIV means what is the difference between HIV and AIDS? Anybody know? Children? Difference between HIV and AIDS. Is it same or is it different? Yes. HIV is actually yes, it's an infection. Human immunodeficiency virus, initial stage, other people may know, may not know that they got the infection. AIDS is the advanced stage. So this is the difference between HIV and AIDS. So this HIV virus starts. How this makes a man immunity deficient? What is HIV virus does is once it enters the body, it takes the system, it blocks the reversion of reverse transcriptase. When our DNA changes, this blocks that one, takes the place of that one, and start behaving like our cells, white cells. And that's the way they block immunity. That's the way how the immunity has deficiencies appears. HIV spreads through body fluids. Biological fluids, mainly it means body fluids. Like blood, semen, vaginal fluids, and also breast milk. If the mother is HIV, if she is positive, she can transmit to the baby. But this can be avoided. 100% this can be avoided. Yes, this will see. All children born of HIV pregnant mothers, they become HIV positive, and that too children below 5 years. The children become below 5 years, they are positive, they will be treated as AIDS patients. They will be treated like advanced HIV patients because the immunity like that and the infection is like that. In the first stage, they will have HIV patients will have fever, flu-like symptoms. Flu-like symptoms, they have headache, fever, sore throat, and rashes. But only in the advanced stage, when they go to the advanced stage, they will have swollen lymph nodes, weight loss, fever, diarrhea, and cough. So these will be symptoms, mild symptoms, and when it is mild, they will have fever, headache, cough, sore throat like. When it will become advanced, they will have lymph nodes, fever, diarrhea, cough. People cannot become infected through ordinary day-to-day contact of HIV people with like kissing, hugging, shaking hands, or sharing personal objects, food and water. So it is important to note that this is very, very important. I request our very respectful dear brother media persons, both visual and also print media. This is my very, very humble request to media to spread this message underlined here. HIV people can live a normal life. It is important to note that people with HIV who are taking ART, antiretroviral treatment, people who are taking ART without missing a day's medicine will have an undetectable viral load. This is important. I repeat, media people, please understand. It is important to know that people with HIV who are taking ART means antiretroviral treatment that is given to HIV and AIDS, and have an undetectable viral load, do not transmit HIV to their sexual partners. So this is a very, very important message. I repeatedly want to stress media people and also children to understand. This is the way I said, those who do not have the raise your hand, please understand that if HIV person takes the medicine regularly without missing, and when they take that one, their blood will have nil virus. Their viral load in the blood will become nil. And such persons will never transmit HIV to others, even to their sexual partners. Yes. So now, how many can raise your hand now? Yes. Now you understand that HIV people, if they take treatment, ART treatment, definitely they will become. So early access to ART and support to remain treatment is therefore critical not only to improve their life. If they take ART, antiretroviral treatment, not only make them healthy, it will prevent the replication of the virus and viral load will be nil and they will become normal like healthy people. And also they will not transmit this virus to others. What are risk factors? The risk factors The risk factors is unprotected sex, not using condoms, drug addiction, having another sexually transmitted like STD means gonorrhea, syphilis, like that. So use of contaminated needles, syringes and other injecting equipment. So here I would like to say the mention that use of contaminated needles, most of the thing doesn't come from health department, health professionals. Most of us we are using disposable needles and this may come from the quacks and this may come from the drug addiction people who are using needles. Injectable drugs with everything. It is most of the thing that means that most of the time they are getting the infection through these sort of needles. So accidental needle stick injuries by healthcare professionals. Many of us when you are trying to remove the needle, it happens. If it happens that is a HIV patient, then we are getting infected. So we should be very careful. So how prevention can be done? So these are risk factors. When avoid the risk factors, so the prevention can be done. So using male or female condoms, being tested for HIV at the earlier stage, medical circumcision in the female is very, very important. That will up to 60% avoid getting infections, HIV. And ARV can also be used to prevent mothers from passing HIV to their children, this odd child. So mothers who are taking ARV, definitely when they become, their viral load is less, they will not pass HIV virus to their children or baby if they are breastfeeding. So they will also the baby also be protected. And even during pregnancy when they are on ART, they will not pass the virus to the baby. The baby will be protected. So this treatment part I leave to our honorable district family welfare officer and also KPME, Karnataka Private Medical Education Authority officer, Dr. Chandan sir. So I will enlighten you short. So there is no cure for HIV. Those who raise your hands, those who have not raised your hands, and at last those who have raised your hands, please understand, there is no cure for AIDS. But that doesn't mean that everything will happen. So only cure is not there, but their viral load will be controlled. When they take ART, their viral load in the blood will be controlled and they will be made like any normal person. That's the way we can have shake and we can break the stigma and they can see that they are protected. To conclude, it is important to note that people with HIV who are taking ART and have an undetectable viral load do not transmit HIV to their sexual partners and others. Early access to ART and support to remain on treatment is therefore critical not only to improve the health of the person and also to prevent the transmission. After treating a person with HIV, they need not worry about further management. Very important. Once a person, even any of us, suppose accidentally become positive, it doesn't mean that you think that our life has come to an end. Nothing. So they don't worry. So once it is positive, the remaining everything the government will take care. The government is taking care. The WHO, World Health Organization, is taking care to see that person's viral load is brought down. So everything will be done by the government. So they will get further lab investigation and medicines. See, this is also I would like to enlighten our media. Once a person is get positive, when they themselves get tested or they get tested with a professional, when they get tested positive, the person should not think that the life has ended. They can, the provision we are doing it, and they let them know that the government is doing everything. Further investigations find out the viral load and grade them, and then accordingly they will get free medicine lifelong. This is very, very important. This is very, very important. The media to enlighten the public. The lab investigation into the government and lifelong medicine, ART medicine is given free of cost. They need not send even a one paisa. Here I would like to tell one of my experience, recent experience. 15 days back, one young lecturer, working as a lecturer, he has come for a skin problem. He has gone somewhere and and again he has come to me. So with the suspicion we have done HIV. Unfortunately, he has become positive. He has broke down. Though he is such educated working as a lecturer, he is broke down. I again called him, I hugged him, put my shoulders on him and told him everything, nothing, don't worry. You can lead a normal life. You can mingle with the family, father, mother, sisters, kids are there, you can mingle with them. Only thing what you have to do the guidelines, follow the guidelines. Refer them to SNR, again they did the blood test, again confirm, and they come at 1 month free of cost medicine, all beautiful medicines. When they follow this, the blood will become negative for this one. Viral load will come down and they can lead a normal life. So, our respectful Dr. Chandan sir, who is the District Family Welfare and KPM Nodal Officer, will elaborate about all the facilities which are available to the HIV patients. Also very important is the community means the victims of HIV and AIDS must break the barrier of the stigma and come forward to lead the community, telling that we are also like you. Please disseminate this message to the people and the people who are with the stigma, the people with the fear of HIV. Definitely they will be benefited. The government is there, WHO is there, and the government is there. Our officers are there to protect the people who are HIV and AIDS positive. Thank you, one and all. Thank you very much.